Good morning. I'm Dr. Michelle Geiser, and I am the Program Director for the Hope Coalition in Henderson County, North Carolina. I'm here today with my director, Julie Honeycutt, to discuss with you the Handle with Care pilot program. This segment of the training is recorded, and we will be available to you at the end for live question and answers. We are aware that this is the last portion between you and your lunch break, and so we promise to be respectful of your time so that you have the opportunity to get up, stretch your legs, and step away from the computer before engaging in the wonderful programs available to you after lunch today. So without further ado, let's get started. Handle with Care is a pilot program that does require the support of your community. For our implementation team, we had the following members: our public school system, our sheriff's office, our police department, our local free clinic, Cross North Center for Trauma Resilient Communities, the Safe Light Domestic Violence Shelter for Women and Children, Advent Health Systems, Pardee Hospital, our local health department, and Community Impact of North Carolina. The Handle with Care pilot is a simple model that allows law enforcement to quickly inform a child's school or child care agency if a child has been at the scene of an incident involving law enforcement. This allows a child's teacher or school staff to be informed of a child's trauma without specific details of the incident, but it does allow the school to best respond and support the needs of that child. So what's working for Henderson County? The coalition. So Hope Coalition is a community collaborative that's worked to build healthy, strong communities through prevention, education, advocacy, and recovery. Hope Coalition is a drug-free communities recipient, and we have been in our community for nearly a decade. Our coalition recognizes our community partners and youth as leaders that are really the driving force to respond to efforts and the support needed in our community to create a healthier community for the long run. The Hope Coalition was identified as a community partner for SYNC because of its strong relationships with the community. Our coalition was able to bring law enforcement and the school systems to the table to discuss and begin to implement the Handle with Care program. Our coalition also offers trauma-focused trainings to its community members, which really helps to build that infrastructure needed for a successful Handle with Care program. The Henderson County public school system has been really supportive and engaged with this pilot program. Matt Grubemeyer, our Director of Student Services, had this to say about Handle with Care. Educators looking to wrap support all of the way around our students know that safer students are more successful students. Programs like Handle with Care allow school counselors, school social workers, teachers, and other school staff to more quickly respond when something in a young person's environment has the potential to adversely affect the student's social and emotional well-being and their ability to learn. Henderson County Public Schools has been engaged in trauma trainings since 2017. The public school systems has offered youth mental health first aid, as well as trauma sensitive schools training, not only for all of their staff, but also for community stakeholders who engage with youth. Since 2017, Henderson County Schools has successfully trained nearly 1,000 people in these two trauma trainings. Our law enforcement, both our Sheriff's Department and Police Department, are committed stakeholders to this program. Every Henderson County public school has an SRO or student resource officer assigned to it, and they are with that school day in and day out for the whole school year. Our sheriff, Lowell Griffin, had this to say about Handle with Care. Making a difference is the #1 reason that we wear the badge. We are proud to be a partner in Handle with Care, where we will not only be able to make a difference, but where we can make a difference in the lives of the most important people in Henderson County, our children. All children deserve the opportunity to be successful, and this program can help them along that path. So what are ACEs? Adverse childhood experiences are stressful or traumatic events that can include abuse or neglect. They can also include household dysfunction, such as domestic violence, or growing up with family members who have substance use disorders. This list is not exhaustive, and we'll look a little bit deeper into it in another slide. But ACEs was made popular by a study conducted by Kaiser Permanente between 1995 and 1997. This study looked at 17,000 individuals in California. It was the largest investigation of childhood abuse and neglect and its long-term impacts that has ever happened. ACEs were strongly correlated with the development and prevalence of a range of health issues across the lifespan. Adverse childhood experiences can include historical traumas. They can include traumas within the social context. And these traumas further lead to the disruption of neurodevelopment, of social, emotional, and cognitive impairments, the adoption of risk behaviors such as sexual promiscuity, self-destructive behaviors, substance use disorders, and can also lead to disease, disability and social concerns, and early death. Dr. Nadine Burke-Harris had further pushed the issue of ACEs forward into the world during her TED Talk provided in 2015, when she looked at not only ACEs, but traumatic stress and what that does across the lifespan. And ACEs can help be mitigated by strong, resilient communities. Handle with Care is one preventative measure that can really assist us in identifying youth who are experiencing adverse childhood experiences and engage them so that we can help support the structure and help mitigate some of these long-term outcomes that we're seeing. The ACE study included questions on physical, sexual, and emotional abuse, physical and emotional neglect, mothers treated violently, substance misuse, household mental illness, parental separation and divorce, or incarcerated household members. Again, this list of adverse experiences is by no means exhaustive. Things like food insecurity, or homelessness, or being involved in a fostering agency. These things weren't captured in this study. So this list is not exhaustive, but knowing what ACEs can look like, what some of our traumatic events can look like, is something that's really significant to providers as we move forward in understanding what individuals have experienced and how those experiences can be expressed behaviorally, emotionally, or otherwise within that person's lifetime. Early adversity has lifetime consequences. Some of those can be injury, mental health, such as depression, anxiety, suicide, or PTSD. Maternal health is impacted, infectious disease, chronic disease, such as cancer or diabetes, increase in risky behaviors, and opportunities, such as education, occupation, and income, can be negatively impacted by early adversity. In Henderson County, we started to look at trauma specifically for our county within the community health assessment. So our community health assessment in 2018 began to really look at our trauma personally in the region. If you would look, the lighter color is Henderson County, the deeper blue is Western North Carolina. The important thing to note is that we have individuals who've experienced all of the ACEs that we called and questioned them on, whether it was emotional abuse, substance misuse, parental separation or divorce, household mental illness, intimate partner violence, physical abuse, incarceration of a household member, or sexual abuse. Our community, as in all of Western North Carolina, has a significant number of its population and community members who have experienced one or more ACEs. And we know that the more ACEs that you've experienced, the higher the likelihood of long-term adversity. Our law enforcement also shared what it's seeing in our community, what the issues are specifically to our community. Some of the things that they spoke on were repeated calls to the same houses for things such as domestic violence or substance use, mental illness of a family member, incarceration of a family member, and overdose. So we are seeing a lot of the same families that are having compacted adverse experiences because they continue to see multiple traumatic events. And traumatic events not only involve a threat to our life and safety, but it impedes our ability to cope. So we start having a more difficult time really understanding how to manage and mitigate the stress that we're experiencing. And the one thing that we can start to relate it to is the global experience with COVID, and knowing that during the time when we weren't sure about the future and we worried about our health and safety and we felt an overwhelming sense of helplessness, that was an experience of a traumatic event. Individuals who are experiencing those traumatic events at home, that are experiencing them repeatedly, are having that engagement of helplessness and concern for safety and well-being that's ongoing. There's no end in sight. And that being compacted with things like COVID, which affected all of us, can end up leading to long-term adverse health experiences for these individuals. Often the Sheriff's Department is sharing that the same children who are witnessing these traumatic events, they're seeing them in the juvenile justice system later on. And not all of the traumatic events that they're responding to involve violence or criminal activity. Some of them are car crashes or medical emergencies or house fires. So law enforcement is seeing children impacted by an array of traumatic experiences, not just what we would think of as an overdose or domestic violence or other violent or threatening traumatic events. So why should you choose Handle with Care? It's a way to respond as a community to children experiencing traumatic events. It's a way to support children and youth and their families in schools to help mitigate trauma and to help build resilience and safer schools. It's a way to connect students and make mental health care accessible to students who need it. At the same time, we're strengthening and improving relationships in communities by allowing law enforcement to have another area where individuals and families are seeing them as being caretakers and supporters of their children. Law enforcement's not there to criminalize things. With Handle with Care, law enforcement is there to protect our children and support our families. Handle with Care was first piloted in Charleston, West Virginia in 2013. It has gained momentum and is being seen in communities throughout the United States. Handle with Care is bridging a communication gap for many communities between law enforcement and schools, and helping those children who are exposed to various traumatic events. Interventions at school, meeting them where they are, is really allowing us to have the most success for that child as an individual and as a student. How does it work? So Handle with Care begins with law enforcement identifying children at the scene of an incident. The only things that we're asking for is the name of the child, the age, and the school that they attend. The school district is then notified before school begins the next day. School staff are provided with a Handle with Care notice, and they respond to that student in a trauma-sensitive way. If needed, the child can then be referred to additional support services. So the notification process. How is the school notified? For each community, this notification process is going to look a little bit different. But for Henderson County, the best way that we knew how to implement it was by creating a designated phone line that goes directly to the Director of Student Services. Law enforcement uses this designated phone line to provide a simple notice. The director then contacts the designated individuals at each school. Each of our schools has a separate crisis team where a point person has been designated. The school is notified that the child was involved in an incident involving police the previous day, and that they may have academic or behavioral difficulties in the coming days. What can that look like? So we've had a student who had end of grade testing, and that student kept falling asleep. He just could not keep his eyes open. What do we do? How do we respond to that student through a trauma lens? Well, our principal came in, and the principal removed the student from the class, and he took him for breakfast. He walked that child down to the lunchroom. He gave him something to eat. He gave him something to drink. He supported him, and the child was able to successfully return to the classroom and proceed with testing. Now, testing isn't our end game. Testing isn't the reason that we're doing this, or for, specifically for academic performance. But that child was not ostracized. They were not sent to the principal's office because they were falling asleep. They were engaged in a trauma-informed way. And that student was able to be successful. Nobody discussed the trauma with that student. Nobody identified him as having witnessed a traumatic event, but he was welcomed with open arms, and he felt cared for, and he felt loved, and he became successful. The school building champions for each group can deliver a handle with care notice to the child's teacher when appropriate, or to the school counselor or the school social worker, dependent upon that school and how their notification process flows within the individual school system. The handle with care notice gives examples of internal and external distress reactions to look for that a child may exhibit. So maybe that looks like a child who's disengaged and sitting in a corner. Perhaps that looks like a child who is being aggressive when they typically wouldn't be. Or maybe a child who is more weepy or acting a little bit differently than they normally would. It just allows us to provide a little grace and understanding for individuals when they're behaving differently, and we want to be supportive. So trauma-sensitive schools. This is a really important note about privacy in the handle with care process. Law enforcement does not provide any details about the incident to the school. Not all the incidents involve violence or violent crime. And so, as I mentioned before, it could have been a car accident. We might have had a fire in the home. It's important to understand that and to come at it not being biased and not attaching any stigma to it, but just understanding that there was an incident. We don't know what it was, but it was something that's going to be impactful to that child. We have to all be vigilant about that stigma and don't discuss it with students. So when a student comes to school, the handle with care notice is not there for us to engage that child and ask them or be supportive and say, oh, are you okay? We heard that there was an incident last night. So in no way is the handle with care notice giving us that opportunity to go and speak to children directly about the trauma that they've experienced. It's only there to inform us that the child might exhibit some behaviors because of an incident, but we don't need to engage them. We don't need to discuss the incident with them, just making sure that we're there and providing a trauma-informed response to students as needed, and that we offer them a little grace. This is just an example of a handle with care notice. As you can see, there's a school, an area for law enforcement, the date, the time, the date of the incident, and the child's name and age. So if your community would like to provide a paper handle with care notice, it can look something like this. There are resources for various handle with care notices and flow charts that will be available to you at the end of this training. So trauma insensitive schools, what are they? So school staff will handle a child with care and respond to them in a trauma sensitive way. Schools are significant communities for our children and for our teachers. And teachers and staff, we're acting as those primary role models for students. Students spend more time with their teachers and caregivers than they do with their parents. So we know that if we can approach them in a trauma-informed way, that we're acting as change agents, and we are providing these students with the best platform to become successful in the long term. Support from us can be as simple as helping a child if they look sleepy, letting them take a nap in the office. Maybe it's not a good day for them to take a test. Maybe it's a good opportunity for them to sit out. Like I mentioned earlier, maybe it's a great opportunity for our administration to take a child for a walk, have breakfast with them, support them, just be a friendly face and provide stability, provide support that they need in that moment. Bringing Handle with Care to your community. What are your next steps? Here's just a really simple coalition action plan that can be followed if you're interested in implementing this pilot program. First step, share the information with your coalition members. Second, determine your key sectors and stakeholders. Meet with those stakeholders to develop policies. What resources do you have? What capacity do you have to launch a pilot or to just bring this pilot to your community? Law enforcement evaluates their current process to see if they can even incorporate Handle with Care. Train law enforcement and school staff on the Handle with Care implementation. This is a 6.5-minute video that provides the training for Handle with Care. And then evaluate the effectiveness of Handle with Care in your community. Were there any gaps? Were there any needs that were addressed or that need to be addressed moving forward? Finding those key stakeholders. The minimum key stakeholders would be a mental health provider, a child care agency, law enforcement, and a school system. Engaging coalition members to identify those key stakeholders and community champions is the best way to move forward. And then as soon as you have that stakeholder participation, let that be expressed in the form of a memorandum of understanding. Next is planning your policy. Determine your capacity to implement Handle with Care in your community. Ask questions like, is my community trauma informed? Is there capacity to proceed with Handle with Care? Who will accept and distribute those notices? Does your school have a crisis mental health team or a lead? Do you have mental health providers that are certified in trauma-focused cognitive behavioral therapy? Training. All key stakeholders must complete that 6.5-minute Handle with Care training. Mental health partners must complete trauma-focused CBT. Not all of them, but we do suggest that trauma-focused cognitive behavioral therapy is something that mental health care providers begin to be trained with if they're going to provide services for students in a trauma-informed way. Additional trauma-informed trainings that can be recommended are trauma-informed communities, trauma-informed schools, trauma-sensitive schools, and mental health first aid. Evaluation. So if you've made it to this point, you've implemented the program. How do we evaluate its effectiveness? We can look at the number of notices that were delivered to our school system. We can look at the number of notices that were reported to dispatch. What were our number of interventions? What were the number of discipline referrals? Number of positive interactions with law enforcement within the school setting, and any barriers to implementation that we've experienced. Your role, should you want to implement Handle with Care, is to be an advocate for the program. So familiarize yourself with the Handle with Care website. You can access Handle with Care resources through our website at elementsofhope.org. Look at the videos. All school staff should watch an overview of early childhood, elementary, or middle and high school and secondary trauma information. Videos are short. You can view them at staff meetings and discussions. Providing resources. Provide documents and links to educators or stakeholders that you are interested in engaging within this program. All other Handle with Care documents are available through Sync, and you can look at that through impactcarolina.org. What we're asking you to do here is to shift your thinking. And instead of asking what's wrong with you, start asking what happened to you. If you have any questions about the Handle with Care program, we are here to answer them and look forward to being able to chat with you just a little bit before we send you off to lunch today. Want to wrap up by giving you contact information for us, any information that we are unable to share with you today, any questions that are left unanswered. We encourage you to email them directly to us or to give us a call, and we would be happy to answer any of your questions moving forward, or to act as a mentor for you if you're interested in beginning this program. Thank you to our partners that we mentioned at the beginning of this presentation, and thank you to you for your time and your advocacy and your work supporting communities throughout North Carolina. Thank you so much, and we look forward to talking to you.